The loss of smell. One of the symptoms of the coronavirus a majority of patients are familiar with. Ear, nose and throat specialist Dr. Moses Penduka says it's all part of a mechanism on how the virus affects smell receptors.
The nasal cavity and the oral cavity is rich in what are called ACE2 receptors. ACE2 receptors, as you know, are the receptors or the lock that the virus uses to enter your system.
A reduced or complete loss of smell is associated with an altered sense of taste, as flavors are the products of smell. Dr. Penduka says losing the ability to smell can be alarming, particularly because it alerts people on the presence of danger, and if it persists, can even cause depression.
Detection of smoke, leaking gas, to appreciate whether food is expired or not. In the absence of olfaction, of a sense of smell, you tend not to appreciate what everybody else is appreciating. And it has been associated with depression and anxiety if it persists.
Typically, one sense of smell should return after coronavirus symptoms have subsided, but if not, there are ways to stimulate it. Olfactory or smell training is a treatment that has long been recommended for patients with viral infections or other causes of loss of smell. It involves repeatedly smelling scents you are familiar with several times a day over an extended period of time, like 6 months.
What smell or olfactory training does is that it reorganizes the nerves in the central nervous system in a process known as neuroplasticity. But the exact mechanism is unknown. One starts by smelling familiar scents like lemon, eucalyptus, clove, and these come in what are called essential oils, and they typically come in small vials like this. There are studies that have shown that it does give some form of improvement in your sense of smell.
Apart from smell therapy, there are other treatments for loss of smell, like sinus washes or topical nasal sprays, which assist in reducing the inflammatory environment in the nose. Dr. Penduka, however, is advising COVID-19 patients to consult their doctors before trying any form of treatment. Francis Shahama, NBC News, Windhoek.